Hello, everybody. My name is Alex Mold. I will be presenting for you today Group 4's Chief Environmental Health Officer as part of the project. So, in terms of the Congo, we do have an outbreak of Ebola, and my role will be the preventing of Ebola from spreading, as well as making sure that the facilities themselves are well maintained and that the staff is well trained and everybody is maintaining safety. So let's get started. In terms of Ebola transmission, there's two parts that are important. There are blood and bodily fluids. Both of these can transmit Ebola, and these are the paramount things that we have to maintain safety for. And we do this through the contact and airborne BSL-4 isolation, which is a totally sealed environment with a separate air system. This prevents the accidental spread of Ebola to the healthcare workers, as well as if a patient were to wear them, a family member visiting a patient, these are required to prevent the spread. So let's talk about healthcare safety workers first. So in order to do this, we need to ensure that they're compliant at all points with BSL-4 isolation. That means they are using it every time they see a patient, and they are also trained in how to put it on and how to take it off. While most exposures actually do not occur during the actual talking with the patient, they actually occur after you're done. And this is the biggest problem because you're, in addition to feeling done, because you've just spent 15 minutes in isolation, you are also in very hot temperatures, which confuses you and it can decrease the reaction time. As such, you're more likely to make a mistake at this point. So proper training in removal is important, just as much as proper training in usage. In addition, you also have to prevent heat exhaustion. This is itself a risk and why you can only spend a certain amount of time in isolation suits before you have to take a break, because otherwise you will develop heat exhaustion and bad things will happen. Additionally, part of the role is patient and family safety. Unfortunately, as Ebola is an infectious disease, that means it can spread from person to person. So as part of the environmental aspect, we have to stop the spread from patients to uninfected individuals. This would involve things like quarantining, which is what is done in the video. And you also have to monitor those who are exposed for symptoms so that you can very quickly isolate those who develop symptoms from those who are otherwise healthy. As such, you're able to prevent the environment in which the disease can continue to spread. And as we saw in the video, they did have water and proper rehydration being performed. This is paramount because in addition to dehydrating that Ebola can do through hemorrhagic fever, as well as fever, which will reduce the amount of water that you retain because of the loss from sweat, you also need to prevent any sort of way that they can lose further water, which would include diarrheal diseases or other gastrointestinal diseases. These would dehydrate further and increase the risk of possibility of contamination. And this is part of the environmental aspect. Additionally, we have to consider the reservoirs and animals, as Ebola is able to cross into monkeys, more specifically gorillas and bonobos, although they are found in other monkeys as well. We also have to consider that as part of the response, and the reservoir for Ebola is likely in bats. At the moment, it's currently correlated and not necessarily causative. However, it's suspected to be in bats. So we also have to consider that when we are talking about the environment in which Ebola lives outside of the village. We also then would have to prevent people from touching sick animals or eating sick animals, as this is a great way for the virus to spread the first time from one species into humans. And we have to educate the population in preventing the future exposure of the virus to the people. And this is all related to the environment in which the disease can begin. Additionally, we do have to consider the health and well-being of both the patients and the healthcare staff. So we'll talk about the first one later, which is the providing safe burials. But this is fundamental because you need to discuss that. Additionally, as seen in the video, but with the case fatality of somewhere between 50 and 100%, you are talking about children that will not have parents as a result of this. As such, you have to increase the environment in which children can ideally continue to grow up healthy, while also providing the ability for them to continue living. And you also have to provide the social support necessary for the patients to think that the hospital is not just a place where they go to die. 50 to 100% case mortality will have that effect. And they did this in at least the video through the survivors cheering on the patients saying that it will be all right. And this is essential for maintaining both the patient and the healthcare staff support. And the mental health, as health and well-being includes the mental health of the patients and the healthcare staff, is paramount as well, and will increase the overall, if the mental health is improved, it will increase the overall effectiveness of the hospital and will decrease the amount of mistakes being made. So this is where we get into the burials. Unfortunately, Ebola is contagious up to 72 hours after the death of the individual. So you do have to have a twofold response, where you have to respect the wishes of the family to have a funeral, while also preventing the family from becoming patients themselves. And this is what they did through the isolation of the patient in an area, which prevents the family from physically touching them, but allows for a funeral service to be held outside of the compound so that proper funeral services may be held for the individual, while also allowing the grieving process to take place and preventing further patients from, or people from becoming patients. After the funeral service is done, you then have to consider the proper burial, which for the most part is just the same as isolation. You have to bury them isolated. However, because of the issues in burying, you do have another exposure possibility point, which is the grave diggers, the people who actually dig the graves and bury them. And you have to educate them in the prevention of any sort of exposure to the Ebola. And unfortunately, grave robbing is a thing, at least in the 2014 outbreak in West Africa, where people would dig up the graves because people tended to be buried with some possessions, and they thought it was a great way to make some money. At the time, there were no cases that were detected that were as a result of grave robbing, but it is important to know that this is an issue for exposure. Additionally, it's a very big issue for the family because they have to then realize the fact that somebody did consider digging up their relative to make some money out of them, and that's not something you want to deal with. But unfortunately, it has to be prevented early so that there's no further issues. So with that, I conclude my presentation. This next slide is my works cited. If you have any questions, please forward them to me. Thank you for paying attention, and I hope to hear from you soon.